We've talked a little bit about gut health and just how extremely important it is to overall health. So we're going to talk today about stomach pain and irritable bowel syndrome.
Right, a great topic for Wednesday. So, it's such a common thing that folks, when over the 15 years of practice, some common things are I'm tired, I've got brain fog, I've got body aches, or I've got irritable bowel. And irritable bowel, it seems to get worse for folks when they're on a road trip, if they're anxious, they got some stress in their life. In a lot of folks, it's either they get one way or the other. And it's either they tend to run a little on the constipated or on the loose side. And it can be some of these things where if they get out of kilter a little bit and going on a road trip, that they can't be too far from a bathroom. They got to get there fast, and it could be with eating something that's maybe not in their traditional realm of nutritional cuisine. But in the days of when I would treat this from a conventional perspective, I would just tell folks, all right, well, if it's diarrhea predominant, loose stool predominant, let's give you some Bentyl, which would slow down that stools. And so this is kind of the game that conventionally that you might see, but it's not really getting to looking at what's really going on here. So, the gut is such a huge part of our health, in the sense that that's the part where many of it's the palace guards that really guide and watch that castle wall are in that gut. And if those palace guards, those castle guards sit down, then it can be all kinds of inflammation and problems that happen in that gut. And so I had a great story from a gentleman that came up from just south of Milford, and for 2 to 3 years, he just, no matter what he did, he was stuck in this irritable bowel. He was bloated all the time. He had this discomfort after he would eat. He'd have to run to the bathroom. And we started him on this repair process, so it's called heal and seal, basically, is what we want to do. We want to identify what is triggering this. And a lot of times this is detective work. And Dave and I were just talking about some detective work on health history and how you kind of have to say, what's causing it? Is it a medication that I've been prescribed that's kind of leading me down this path of these symptoms? Is it a food that I've got an intolerance to? Is it some kind of chemical or toxin or pathogen, like a bacteria or virus that I've got hanging out there? And so we got to do this detective work, and a lot of times that's what folks that are coming into the clinic here to do their direct primary care with me, where they establish with me as their provider. This is the path we're starting down, is trying to figure out, exactly how do the pieces fit together and what is causing this. So this gentleman that came here from south of Milford, again, was struggling this with 2 years. He went off, got a colonoscopy, all the EGD, the scope down the throat, all that checked out, but he was still miserable. And so that's what we did. We started to identify. He met with Molly, one of our great team members here, functional nutritionist, and identified some triggers and started to remove those, and then got him on a heal and seal protocol, and he has been doing fantastic. Quality of life again back. He's not having the bloating, the distension in his belly. He's not uncomfortable after he eats, and he's not having to run to the bathroom after he eats. So it's all good.
That is all good. One of the things, I've been actually following some people that emphasize the gut health, and one of the things that's pretty dangerous to the gut is all this processed food.
Oh, it's the more you dig, the more you realize how much our body is trying to combat just to stay in balance every day. And the processed food, rancid oils are another one. If you're cooking with the wrong oils, And, good oils would be like avocado oil to cook with, doing some coconut oil. But a lot of these rancid oils that are in a lot of these processed foods, that's one of the reasons these processed foods might not be good, amongst many reasons, but is these rancid oils lead to inflammation in the blood vessels and throughout the body. So we're literally eating food, if you want to call it that, that's inflaming our body. And so it is, once you start to realize this, you're like, oh my goodness, I'm literally eating garbage. And it's no wonder I feel like garbage. If I'm eating garbage, I'm going to feel like garbage. So that's a big part of working forward, is really that nutrition piece, what you eat, and then helping the body get back on that healing path. And there's a way to do that besides just avoiding the toxic food. Aloe, slippery elm. There's different things that are really more homeopathic, natural stuff that are in some of the products that we recommend that are really soothing to that gut. Again, help get back into that sealing up. As I talked about the castle wall having kind of the guard standing down so the enemy can get by in the small intestine and cause inflammation. If you're sealing those holes with different products, and a lot of times you can do it nutritionally as well, then those castle guards are standing back up and protecting the small bowel, and you're not getting those intruders to get past that lead to all this inflammation. So, if they're standing down, that those intruders get past that small bowel, which is just after the stomach, and they can get in there, and your body can start identifying these things that are toxic as bad for the body, and then we attack what just came through there. So this is where a lot of people develop autoinflammatory disease. It can start literally at the gut. Too many antibiotics over the years as well. It's a big, I just talked to a young gal that came in yesterday, and when some of her inflammatory conditions started in her teenage years, turned out she'd had some antibiotics, and what that does is that affects that balance in the microbiome, we call it, in the small intestine. So her body then was not as able to fight off intruders and problems, and I think then eventually that was one of the main reasons that she started to develop some joint pain and inflammatory, like rheumatoid type symptoms, rheumatoid arthritis type symptoms. So it's literally so much starts in the gut. It's incredible. And that's the name of the game, is just it's that detective work. And when you come in to see us, we're going to take more time to sit down with you, because we've got longer appointment times, and you sign up for the membership, and with me managing your primary care in concert with you, because it's a team effort. A lot of times I have folks coming in and telling me, "Oh, I read this, and this worked for me," and so it's kind of a two-way street. We go on this path together of learning these things, because we are like a layered onion. We build up these layers over time, and then we got to do the detective work to determine, all right, yep, that's what's triggering it. It's this toxin, or it's this prescription medication, or it's whatever it may be. It's this viral overgrowth or bacterial overgrowth. So sometimes it can be a quick solution, and a lot of times when we get young folks in their 20s and 30s, it's easier to turn things around a lot more quickly because they haven't built up as many layers of onion. So that's a big key too. I tell folks that are in their teens and to 20s and 30s that don't just ignore it and say, "Oh, I got to go on a prescription now." If we can identify that now and start to work on fixing it now, then we don't go down that road where 10 years, 15 years down the road, we got more layers on the onion, more disease processes have developed, and you're on 5 or 10 medications at that time. So that's what we want to try to avoid.
And once you get on, and we're out of time, once you get on 5, 10 medications, it's much harder to do that detective work to see if a medication might be one of the issues that you're having real quickly, and then we have to go. Friend of mine I was telling you about last week was positive he needed to have his gallbladder out, was absolutely positive the imaging came up with the fact that no, he probably didn't need to have his gallbladder out. He was positive. Couldn't sleep but maybe an hour at night. His gut was absolutely killing him. Found out that the side effects, one of the medications that he was taking was back pain and an irritable stomach. Went off the medication, and in a couple of days, he doesn't need to have his gallbladder out right now.
That's pretty powerful testimony there, Dave. And and so that's that. Digging yourself, and make sure though, if you are going to stop that medication, that you're consulting with your physician to do it in a way that you don't need to wean off of it or something like that. Because some medications you can flat out just stop, but you want to discuss it with your medical doctor, or give us a call, sit down, and ask us your questions. So
right, and listen, some of these medications, amazing medicines, but some of them do have some side effects that affect people.
Absolutely. So it's kind of the more that we have in the toolkit, and sometimes, again, as I say, that conventional medicine, when we need it, we're happy we have it. But it's nice to have all these other options as well, and have kind of this balanced approach to take. So we got more tools, more options.
All right. Well, listen, if folks want to come over and see you, how do they do that?
Yeah, give us a call, 712-339-6024. We do a welcome visit as well for those that are thinking about joining the membership with me, helping manage their primary care. That's a 15-minute visit for free. You sit down and we just kind of talk about the direction where you want to go. But we are literally right next to Ace Fix Hardware in Spirit Lake off of Highway 71. And we'd be happy to give you a tour at any time. Next Wednesday, now this Wednesday, we've got another Wellness Wednesday talk at the clinic. And so we got those on the first and third Wednesdays of every month.
Very good. Dr. Meyer, have a great day. We'll chat again soon.
Sounds great. Thanks, Dave.
Thank you, Dr. Bradley Meyer, Okoboji Wellness Clinic. You can also find them at okobojiwellnessclinic.com.